Astigmatism, seeing the world clearly again. Ever feel like the world is slightly out of focus no matter how much you squint? You might have astigmatism. Let's dive into what it is, how it affects your vision, and what you can do about it. Astigmatism is a common vision condition that causes blurred vision at all distances. It happens when the cornea, the clear front surface of your eye, or the lens inside your eye, isn't perfectly round. Think of a normal eye like a basketball, perfectly spherical. An eye with astigmatism is more like a football, with an irregular curve. This irregular shape prevents light from focusing properly on the retina, the light-sensitive tissue at the back of your eye. Instead of focusing on a single point, light focuses on multiple points, causing blurry or distorted vision. It's like trying to watch a movie with a slightly warped screen. The primary symptom of astigmatism is blurred or distorted vision at all distances. This can make it difficult to see clearly, whether you're reading a book, watching TV, or driving a car. You might also experience eye strain, headaches, and difficulty seeing at night. Some people with astigmatism also report squinting frequently to try and improve their focus. In children, uncorrected astigmatism can lead to learning difficulties and developmental delays. Early detection and correction are crucial for optimal vision development. Do you suspect you might have astigmatism? Look out for these common symptoms: blurred vision at any distance, eye strain or fatigue, frequent headaches, difficulty seeing at night, and squinting. If you experience any of these symptoms, it's important to schedule an eye exam with an eye care professional. They can accurately diagnose astigmatism and recommend the best course of treatment. Don't ignore these signs. Early detection and correction can significantly improve your vision and quality of life. While the exact cause of astigmatism isn't always known, genetics often play a significant role. It's common for astigmatism to run in families. Astigmatism can also be caused by eye injuries, certain eye diseases, or even surgery. In some cases, it can develop after a corneal transplant. While anyone can develop astigmatism, certain factors may increase your risk. These include a family history of astigmatism, certain ethnicities, and specific medical conditions. Diagnosing astigmatism is a simple and painless process. Your eye doctor will perform a comprehensive eye exam, including a visual acuity test to measure your sharpness of vision. They will also use a phoropter, an instrument with different lenses, to determine the refractive error in your eye. This helps them identify the degree and type of astigmatism. Corneal topography, a mapping of the cornea's surface, may also be used to provide a detailed analysis of the cornea's shape. This is particularly helpful in diagnosing irregular astigmatism. Fortunately, astigmatism is highly treatable. The most common treatment options include eyeglasses, contact lenses, and refractive surgery. Eyeglasses are a simple and effective way to correct astigmatism. Special lenses are prescribed to compensate for the irregular shape of the cornea or lens. Contact lenses offer another option for correcting astigmatism. Toric contact lenses are designed specifically to correct astigmatism and provide clear, comfortable vision. Refractive surgery, such as LASIK or PRK, can permanently correct astigmatism by reshaping the cornea. These procedures use lasers to precisely alter the cornea's curvature, improving focus. LASIK involves creating a thin flap in the cornea, reshaping the underlying tissue, and then replacing the flap. PRK, on the other hand, removes the outer layer of the cornea, which then regenerates over time. The best surgical option for you will depend on your individual eye health, the degree of astigmatism, and your lifestyle. Consult with your eye doctor to determine if refractive surgery is right for you. Even with corrective lenses or surgery, there are things you can do to manage astigmatism and maintain good eye health. Regular eye exams are crucial for monitoring your vision and detecting any changes. Ensure proper lighting when reading or working on close-up tasks to reduce eye strain. Take frequent breaks to rest your eyes, especially when using digital devices. Consider using lubricating eye drops to keep your eyes moist and comfortable, especially if you wear contact lenses. A healthy diet and lifestyle can also contribute to overall eye health. Astigmatism is a common and treatable vision condition. Don't let blurry vision hold you back from enjoying life to the fullest. If you suspect you have astigmatism, schedule an eye exam with your eye doctor today. Early detection and treatment can make a significant difference in your vision and overall well-being. Take action now. Book an appointment with your eye care professional to discuss your vision concerns and explore the best treatment options for you. Share this video with your friends and family to raise awareness about astigmatism and help them see the world in focus too. Thanks for watching. Please like and subscribe. See you on the next video.